Hey guys, my name is Zion Luca. I'm currently a master's student under Dr. Calloway, and today I'm going to go over some common cow diseases with you guys, as well as some of the symptoms and preventative and treatment options as well. First disease that we're going to get into today is bovine respiratory disease, or commonly referred to as BRD or shipping fever. So, BRD oftentimes flares up after periods of high stress, and this is because that stress is suppressing that host immune system and defense mechanisms. And when we talk about periods of high stress, this is going to be those times of weaning or transport, passage through a sale barn, or whenever they get bought up by a feedlot and enter that commingling phase or go through processing, or if you have calves that haven't been castrated yet, by the time they arrive to the feed yard, that castration or any surgical procedures that would need to be done on them are also periods of high stress. And staying on the topic of feed yards as well, whenever those calves arrive there, they enter that dry and dusty environment, and that on top of the added stress they receive from that big transition in their life, it ends up being most prevalent time when we see cases of BRD flaring up. So getting into some of the symptoms of BRD here, we can break it down into two different signs. That first being our general signs. So just like any other animal that's sick, a lot of times they're going to run a fever, but without using a thermometer to be able to tell if they're running a fever or not, we can just see if they have an overall depressed look on them. If they go off feed, that's also a common sign of any kind of sickness, or in this case, BRD, and they'll just have an overall dullness to them. They just won't look as lively as their counterparts will. And into some of those respiratory signs, we can first talk about that rapid and shallow breathing. Calves will just have an overall difficulty breathing, and you can oftentimes kind of tell that they aren't taking big deep breaths. And next would be coughing. So in early stages of BRD, the lungs and the airways are generally pretty painful. So that animal is going to try and clear that airway with a mild tentative soft coughing. Later on, though, into the later stages of BRD, we start to get more of a loud, prominent coughing, or more of a honking, and that can indicate more chronic or advanced cases, at which case treatment ends up kind of becoming more difficult. And then last two would be a watery, thick white or yellowish mucus, or blazing or bloody nasal discharge and eye discharge. And lastly, advanced salivation in comparison to a normal calf. So lastly, getting into some of the prevention and treatment options we have with BRD. The first one is going to be more of a management strategy, and that's just decreasing overall stressors. So whenever those calves end up coming to a yard, just trying to assemble them rapidly into non-established groups. Another way we can do this too is by going more towards preconditioned calves, and you'll see a lot of times feedlots will pay a premium for those preconditioned calves because they've already been weaned off their mothers for anywhere from 30 to 45 days and have already been bunk trained. So a lot of that stress that they would get immediately from going into that new environment is a lot less abnormal to them, and they've already kind of experienced that. And then next would be transport. So whenever we talk about that, it's just making sure that they have access to feed and water throughout periods of transportation, and then again, just making sure they aren't on that truck just forever. And next would be our dietary prevention, which is just making sure that we transition these calves onto those high concentrate diets gradually. We can't just bring them into the feed yard and throw them on a finishing ration right away. A, because they'll get acidosis, and that would be no good. And then B, though, is making sure that we establish that good microbiome and that good gut health by not just straight off introducing them into high concentrate diets. And then next would just be metaphylaxis. So this would just be administering an antimicrobial to all those cattle upon arrival. We can do this by using a modified live vaccine that contains viral antigens and bacterial components of that shipping fever, try and prevent it from occurring. So our next disease we're going to get into is bovine viral diarrhea, or BVD. And this is more common in our calves that are younger from 6 months to 2 years of age. However, all ages are susceptible to this disease. And this is a disease too where we have cattle that are more commonly infected or persistently infected. And we'll call those calves PI cattle. And they're just natural virus reservoirs. And this infection ends up causing immunosuppression, increasing the risk of a secondary infection and death. However, though, most of these cases end up being subclinical and not being outright too serious. And BVD ends up getting spread through saliva, nasal discharges, any bodily fluids can be vectors for the spread of BVD. And then BVD also has two types as well. So first type is going to be cytopathic or CP, and then we have non-cytopathic, which is NCP. And the distinction is based on characteristics of the virus when grown in a laboratory tissue culture. The NCP strain reproduces without damage to infected cells and represents about 95% of field isolates, while that CP type ends up resulting in the death of those target cells. So getting into some of the symptoms of BVD, so just like with BRD beforehand, any of those animals that are sick are generally going to have a fever and an overall depressed look. And then we'll also get some eye or nose discharge as well from them. And then, like the name suggests, they'll get diarrhea for several days after onset. And I think it's also worth noting as well that BVD can be spread through the calf in utero through PI cattle. And this ends up spreading in utero with a NCP, bovine viral diarrhea, and ends up surviving as a result in a continuing reservoir of those BVD infections. However, though, some of those calves that are considered a PI are just outwardly normal and may not even show some of the symptoms of BVD. So getting into some of those prevention methods that we have for BVD. First is going to be quarantining any new cattle for 2 weeks. This is going to help them from spreading BVD to the rest of your herd right away, and it will allow you to see if they show any of the signs of BVD, so that way you don't end up commingling them with the rest of your herd. And then next would be calling any of those persistently infected calves. This is going to decrease the spread or the chance of spreading for BVD. And then lastly is just making sure you vaccinate your cattle. You can use a modified live vaccine to prevent as a treatment. And these vaccines are oftentimes a CP strain, as only NCP strains of BVD are associated with persistently infected cattle. So this next disease we're going to get into is mastitis. So I'm sure we've all heard of this one before. Mastitis is that inflammatory reaction of the udder whenever it ends up becoming infected. And this disease ends up being one of the greatest losses to the dairy industry. I ended up finding some numbers on it, and globally it's anywhere from $19.7 to $32 billion a year. In the US alone, subclinical mastitis ends up accounting for $1 billion in loss to the U.S. dairy industry every single year. So mastitis ends up being a pretty big deal and something that's really important to figure out how to prevent, spot, and treat. So getting into some of the symptoms here of mastitis. So that first symptom is going to be inflammation of the udder. The udder is going to end up turning into kind of a red and a hard mass. And our next symptom is going to be that swollen mammary gland, and this can even be hot to the touch. And the mere touching of that mammary gland is going to cause pain and discomfort to that animal. This can lead to those animals kicking and trying to prevent you from milking them due to that discomfort. And then next would be an obvious drop in milk yield. And this makes sense, when we think about having an infection of the udder. The udder is where we get that milk from. And we can even see a total stop in production if that mastitis gets bad enough. And then lastly, some of our symptoms are going to be that milk being tainted with some blood clots, some foul smelling brown discharge, and we can see just some other normal animal sickness symptoms, which would be lack of appetite, overall depressed look, hindrance in mobility, and digestive orders and diarrhea. And then lastly, we're going to get into some of that prevention and treatment for mastitis. This is kind of more of the bare bones stuff, but because this is such a costly issue in the dairy industry, there's certainly a lot more information out there on the internet if this is something you're interested in learning more about. But getting into that prevention of mastitis, we can use detection tests like the California mastitis test to figure out if we have cows that are uh, starting to get mastitis in our herd. And then another way would be making sure that we have those clean facilities. So making sure that that bedding is dry and adequate for those cows to lie in and keeping those teats clean. And then as well as using some germicidal teat dips after milking to try and prevent any kind of infection from going up into those teats and into that udder. And then when we talk about treatments, one way would be using antibiotics. So we can give those shots intramammary. And then we can also do dry cow therapy, which is a lot of different stuff out there on that as well. And what this is basically, though, the meat and potatoes of it is treatment of cows with antibiotics during that dry period to try and prevent and manage mastitis. And there are two different types of dry cow therapy. We have our blanket dry cow therapy, which just means that we're giving every single one of those cows antibiotic treatment during that dry period. And then we also have our selective dry cow therapy. And that is when we only administer antibiotics to infected cows or even more specifically the infected quarters of that cow's udder. And we're starting to see more of a push towards that selective dry cow therapy because of antibiotic residues and resistance becoming more of a hot topic here. So the next disease we're going to get into is brucellosis, or commonly referred to as Bang's disease. So bovine brucellosis is a reportable and contagious disease caused by the bacteria Brucella abortus, and this is primarily affect cattle, bison, and other cervids. And brucellosis is also a zoonotic disease, so this disease can transmit to humans as well. And although it's pretty rare in the U.S. and Canada to see Bang's disease, in other countries though, like the uh, Middle Eastern countries and Mexico, Bang's is more of a prevalent disease. And then bovine brucellosis is also commonly transmitted by contact with infectious and contaminated discharges, such as fetuses, placental membranes, and fluids that are present after an infected animal has either aborted or calved. And cows that end up ingesting that bacteria by licking those reproductive discharges or reproductive organs of other cattle and end up consuming contaminated feed and water as well. And then brucellosis is able to be carried from one herd to another by an infected animal or exposed animals. And these diseases end up also spreading by exposure to wild infected animals. For example, feral swine are a potential vector for brucellosis. So when talking about some of the symptoms for Bang's disease, first off, I think it's just worth noting that a lot of times the overall health of these animals isn't really going to be impaired, and that can make it kind of difficult to tell if an animal has Bang's or not. But with that being said, though, the most obvious sign of a cow having Bang's disease ends up being just straight up abortion of fetuses or abortion of those calves. So these infections are going to end up causing stillborn or weak calves, retained placentas, or a decrease in milk production as well. And then when we talk about our male counterparts, it's mostly going to be seen affecting the male reproductive organs in bulls. So consequently, organs that are present in the semen can end up being seen in seminal plasma samples from infected bulls. And then we can also see testicular abscesses occur in bulls as well. And then in more chronic infections, we may end up even seeing arthritic joints. So when talking about prevention and treatment of Bang's, the first one's just going to be proper sanitation. So just making sure that we're keeping everything clean, trying to prevent spread of disease from just having dirty facilities, etc. And then next is going to be more management based. So making sure we're utilizing vaccines, recording those animals' IDs, having organized records, and then isolating and testing any animals that we purchase from outside the herd. and then likewise doing the same for any cattle that end up re-entering the herd, and just making sure that we are arranging those diagnostic workups and necropsies for any animals that we suspect to have Bang's disease. Unfortunately, there aren't really any practical treatments available for those infected with Bang's, and we can only get to that eradication point of Bang's in our herd and uh, throughout the U.S. from having those testing and culling of positive animals happen. So the next disease we're going to get into is leptospirosis, or just lepto for short. And it's a common disease of cattle that generally results in reproductive failure such as abortion and infertility. This disease is caused by that bacteria on that first bullet point there, and is contagious and spread by cattle, a lot of times through the bull in the herd, as that's the animal that's going to be coming in contact with all those females. Diagnosis of this disease is oftentimes difficult and may require urine testing, and this is going to be problematic as well, as that can only be done by certain animal disease diagnostic labs, and control of the disease is oftentimes based on the use of vaccines specific for this disease and the use of antibiotics to eliminate the disease carriers. Once an animal comes in contact with lepto, it ends up entering the body, and after a period of time takes up residence in the kidneys and reproductive tract, where it is protected from the immunity produced by the lepto vaccines. This ends up resulting in infection of an embryo and embryo loss in early pregnancy or abortion in later phases of pregnancy. And it's been estimated that more than 50% of the herds in the southeast are actually infected with lepto. However, the infection rate is believed to be much lower in beef herds than dairy herds.
Hey, excuse me.
So just like with Bang's disease, lepto is a disease that mainly affects those reproductive organs and traits in our breeding stock. And with that being said, a lot of times lepto can go unnoticed in a herd. You'll oftentimes have cattle that end up losing that embryo or end up having the death of that embryo and still return to their normal heat interval within that 21-day cycle. So that makes it really difficult to even diagnose. But the main symptoms that you get from females that have lepto in the herd are they're going to have those decreased conception rates, abortion. They'll have those calves end up coming out as stillbirths or oftentimes weak. And after they have a successful calf, they'll end up having some delayed return to heat, so increasing that breeding interval. And a lot of times, like we talked about too, with those urine tests to actually detect and see what animals in your herd have lepto, those tests aren't oftentimes the end all be all, and you can get a lot of false negatives. I read one paper that said 30% of the negatives are actually false, and there's a lot of labs that don't even do this urine testing or don't take those samples. So diagnosing lepto can actually be really difficult in herds, and the symptoms don't make it too much easier. So next is getting into the prevention and treatment of lepto. So as far as prevention goes, the best way to vaccinate from lepto is simply to give them a shot, and just to have that good vaccination program and making sure that you have that established relationship with your veterinarian to have a good herd health program, so that way we can prevent diseases like lepto from spreading in your own herd and to other herds as well. So when we talk about that vaccination, popular way is giving them a 5-way lepto shot. And a little fun fact on that is that the lepto shot that's been around for the longest time is actually based upon the British strain of the organism. And it wasn't until recently that we started seeing some vaccines that were produced specifically to the US strains of lepto. And it's also worth noting too that neither of those vaccines are actually going to clear any existing infections. And heifers oftentimes end up becoming infected long before they end up being bred and vaccinated, just because it gets spread in utero to those breeding females. And it's also important too to make sure that you have your bulls vaccinated, because just like I had said before, that bull's going to be coming in contact with a good number of your herd. And if your bull has lepto, that's just a surefire way to make sure your whole herd ends up getting in contact with this disease, and making sure that we isolate and quarantine any new additions to the herd. It's oftentimes recommended to do this for a month period. This will help us slow down that spread and give us a chance to actually see if maybe that animal does have lepto. And then lastly, as far as treatment goes, there's been some use of antibiotics in hopes of treating lepto. However, though, the results of those have been pretty mixed, with different varying opinions on it, if it actually works and how well it is effective. So last disease we're going to go over today is foot rot. So foot rot's essentially just a bacterial infection of the foot. And the way this ends up happening is the bacteria that's actually responsible for this is constantly on animals at all times. It starts becoming a problem, however, though, whenever it's able to enter into the skin and into that hoof wall, whenever it becomes compromised. So we can get this happening whenever we have excess moisture. So if you have cattle that are slopping around out there in the mud, constantly in that wet environment, that's going to end up allowing the bacteria to enter through that hoof wall a lot easier. And likewise with nutrition deficiency, so with zinc, selenium, copper, if we don't have adequate levels of that, that's going to end up making it easier for that bacteria to enter into that skin and hoof wall there. And then injury is pretty self-explanatory. So like if we get a cut, that cow ends up cutting itself on its skin, that's a pretty easy way for that bacteria to enter in to the animal. And then lastly, disease. So just having that compromised immune system there is going to make it easier for the other bacteria to enter into the animal and harder to fight off. So luckily, unlike our last two diseases, lepto and bangs, foot rot actually has some pretty easy symptoms to diagnose. And the main symptom with it is just going to be lameness of that animal. So because of that infection, they're going to end up getting some swelling and some redness to their feet and legs. And that's going to make them not want to put any weight on it, causing them to end up being lame. And you'll see this swelling and redness around that coronary band or the foot of that animal. And a lot of times too, if an animal's lame and they got some kind of lesion around that foot, that's going to end up giving you a pretty good sign that it's probably got foot rot. And they can oftentimes have a foul odor around that as well because it is infected. And if it ends up getting bad enough, we can start seeing some swelling around both digits of that hoof, and this can lead to separation of the claws. And the claws are just the two digits down there of the feet, and start seeing those spread apart because of that inflammation and that swelling. And then loss of appetite, just like a lot of our other infections and sicknesses. When an animal's sick and not feeling too good, it's probably not going to want to eat. It's worth noting too, though, that there's some other diseases that have pretty similar symptoms to this, like our hairy heel warts. That's a pretty common disease you'll find in like feed yards if it's been raining a lot recently and it's been really muddy out there in the pen. Calves will end up getting hairy heel warts if they aren't given proper preventative measures. And then same thing with our dairies as well. You can see hairy heel warts in them. And then our grazing cattle as well. We can get fescue foot, which is whenever cattle are grazing some endophyte infected fescue pastures, and that disease also has pretty similar symptoms and leads to loss of blood circulation around the foot, and then once again lameness because of that. So getting into some prevention and treatment here of foot rot. So the big way we can prevent foot rot is simply through management practices and making sure we're taking good care of these cattle and the environment that they're in. So we can do this by trying to limit some of those abrasive surfaces that they're on. So limiting the amount of frozen or dry mud that they're having to walk on, some brush and stubble and gravel. So anything that's just going to be abrasive to that hoof and cause any possible lesions to allow that bacteria to enter into that animal. And then likewise with that, making sure that we reduce the amount of mud that those animals are having to stand in. So making sure that we have pens that are well drained and frequently scraped and groomed, making sure that around those bunks and water tanks in the pens that we have some concrete down there or some kind of dry footing to make sure that they aren't just standing in mud whenever they're trying to eat or drink. And then likewise with our grazing cattle, making sure that we maintain those areas around ponds, or water tanks that we have out there in the pasture, just to make sure that they don't have to spend too much time in mud. So that way that hoof wall doesn't end up getting soft and allowing some of that bacteria to be in there. And then another way we can prevent it too is by the use of foot baths. So these are pretty common on dairies and feedlots. You won't necessarily see them at your local cow-calf producers facilities, but we can use these foot baths whenever we're going to milk cows in a dairy. They can run them through that foot bath real quick, or whenever they're processing cattle at a feedlot and giving them a round of shots or implants, a pretty quick and easy way to make sure that they get some of that antimicrobial solution on their foot to kill any of that possible bacteria that could cause that infection. And then lastly, too, like we had talked about with zinc being a factor in preventing foot rot from developing, is making sure we give adequate levels of zinc in the diet, and we can do this by just simply supplementing it into the rations. And then onto our treatment for foot rot. So treatment of foot rot is normally pretty successful if we catch it early enough. And we can start that by simply evaluating the foot and cleaning it off and ensuring that foot rot is actually the cause. Because like we had just talked about, there are some other diseases that have similar symptoms to foot rot. So making sure that we're actually trying to treat what's actually there is pretty important. And we can administer antibiotics or antimicrobials to help kill off that unwanted bacteria and help that animal start getting back to being healthy. And then we can give them an anti-inflammatory as well for the pain to help with some of that lameness and swelling and whatnot to make that animal just have a better general welfare. And lastly, the animals that we do end up getting treated, we need to make sure that after we treat them that they're in a dry area, so that way we can allow that healing to happen as fast as possible. And we should generally see improvements in about 3 to 4 days. And if we don't see improvement in that time frame, that oftentimes means that that infection is probably more prevalent in some deeper tissues, and we need to take some extra steps there in treatment. So that's all I have for y'all today. I appreciate y'all listening to this. Here's my works cited in case you want to learn any more about some of these diseases. Sorry I went a little bit over on it, but I felt like there's a lot of good information to cover there. So thank y'all and have a good rest of your day.